Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
This is Dr. Ted O'Connell with the MedPrep to Go Step 2 Qbank podcast. Today, we'll be reviewing 3 primary care questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you have feedback or you'd like to get involved in this project, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know about it, as that helps us a lot. All right, let's get started with the first question. A 40-year-old man presents to the clinic for dizziness, which began this morning. After waking up, he has been experiencing a spinning sensation not lasting more than a minute at a time, associated with nausea. He has had some lightheadedness during the day, but denies hearing loss or tinnitus. He recently recovered from an upper respiratory tract illness 3 weeks ago. Past medical history is unremarkable, and he does not take any medications. Vital signs are normal. Which of the following is the next best step in management of this patient? A, CT scan of the brain. B, Dix-Hallpike test and Epley maneuver. C, meclizine. D, MRI of the brain. Or E, vestibular and balance rehabilitation therapy. The correct answer is B, Dix-Hallpike test and Epley maneuver. This patient most likely has benign paroxysmal positional vertigo, or BPPV, characterized by sudden onset, recurrent, and brief vertigo that occurs with positional changes of the head. It is diagnosed with the Dix-Hallpike test and treated with canalith repositioning maneuvers, such as the Epley maneuver. Answer choice A, CT scan of the brain, is incorrect. Brain imaging is indicated if there is concern for tumor. Although the patient has nausea, the spinning sensation is short-lived and does not result in vomiting. Additionally, the patient had an upper respiratory tract illness prior to these symptoms, which makes the diagnosis of BPPV more likely. Answer choice C, meclizine, is incorrect. Meclizine is a treatment used for motion sickness, especially in Meniere disease. Answer choice D, MRI of the brain, is incorrect. Brain imaging is primarily indicated if there is concern for a tumor. Although the patient has nausea, the spinning sensation is short-lived and does not result in vomiting. Additionally, the patient had an upper respiratory tract illness prior to these symptoms, which makes the diagnosis of BPPV more likely. Answer choice E, vestibular and balance rehabilitation therapy, is incorrect. Vestibular and balance rehabilitation therapy is used if vertiginous symptoms persist after appropriate treatment. The key learning point here, the Dix-Hallpike test is a diagnostic maneuver used to identify benign paroxysmal positional vertigo, or BPPV. The Epley maneuver is used to treat BPPV once it has been diagnosed by the Dix-Hallpike test. Question 2. A 56-year-old woman presents to her primary care physician for a routine follow-up. She has a history of hypertension and type 2 diabetes mellitus, for which she is taking lisinopril 20 milligrams daily and metformin 500 milligrams twice daily. Her last hemoglobin A1C was 6.3% 2 months ago. She has no acute complaints. She does not smoke, but occasionally has a glass of wine on the weekends. She has been eating a healthier diet with more fiber and fruits in the past couple months, and she's been trying to exercise at least once a week by walking 2 to 3 miles. Vital signs include blood pressure, 122 over 60 millimeters of mercury, heart rate, 68 beats per minute, and respirations, 16 per minute, with oxygen saturation of 99% on room air. Her lipid panel shows a total cholesterol, 167 milligrams per deciliter, HDL cholesterol, 43 milligrams per deciliter, LDL cholesterol, 101 milligrams per deciliter, and triglycerides, 175 milligrams per deciliter. Her 10-year risk of cardiovascular event is calculated to be 5.3%. Which of the following is the most appropriate next step in management? A, atorvastatin 40 milligrams daily. B, coenzyme Q10 supplement daily. C, omega-3 fish oil supplement daily. D, pravastatin 20 milligrams daily. Or E, simvastatin 20 milligrams daily. The correct answer is E, simvastatin 20 milligrams daily. The United States Preventive Services Task Force, or USPSTF, recommends a statin for the primary prevention of cardiovascular disease for adults aged 40 to 75 years of age who have one or more cardiovascular risk factors, such as hyperlipidemia, diabetes, hypertension, or current tobacco use, and an estimated 10-year risk of a cardiovascular event of 10% or greater. Note that this patient does not meet criteria for initiation of a statin according to the USPSTF recommendation. The 2019 American College of Cardiology and American Heart Association guideline has a Class 1 recommendation that in adults 40 to 75 years of age with diabetes, regardless of estimated 10-year atherosclerotic cardiovascular disease risk, a moderate intensity statin therapy is indicated. It's important to note the discrepancy in two different guidelines. According to the ACC and AHA guidelines, a moderate intensity statin therapy is indicated for this patient with a history of diabetes. The patient does not meet criteria for statin therapy according to the USPSTF recommendation. However, not offering a statin is not one of the answer choices here. Answer choice A, atorvastatin 40 milligrams daily, is incorrect. Atorvastatin 40 milligrams is a high-intensity statin. It is recommended in patients with multiple risk factors, such as having type 2 diabetes for 10 or more years, or more than 20 years of type 1 diabetes, or the presence of retinopathy, neuropathy, or chronic kidney disease with an estimated GFR of less than 60 milliliters per minute. Answer choice B, coenzyme Q10 supplement daily, is incorrect. Coenzyme Q10 has not shown evidence as a lipid-lowering agent. Answer choice C, omega-3 fish oil supplement daily, is incorrect. Fish oil decreases triglyceride levels, but it is not indicated as a guideline-directed therapy and is not indicated in this patient as her triglyceride level is borderline. Answer choice D, pravastatin 20 milligrams daily, is incorrect. Pravastatin 20 milligrams daily is a low-intensity statin. To make it moderate intensity, the dosage needs to be 40 to 80 milligrams daily. The key learning point here: understand the differences between the American College of Cardiology and American Heart Association statin guidelines and the guidelines provided by the U.S. Preventative Services Task Force. It's important to know which statin is considered low, moderate, and high intensity at a specific dosage.
This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me, and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops! Lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker, and then I'll get back to it.
On December 12th, Disney Plus invites you to go behind the scenes with Taylor Swift in an exclusive 6-episode docuseries.
I wanted to give something to the fans that they didn't expect. The only thing left is to close the book.
The end of an era. And Don't miss Taylor Swift, The Eras Tour, the final show, featuring for the first time the Tortured Poets Department. Streaming December 12th, only on Disney+.
Question 3. A 60-year-old man comes to the office for a follow-up of his high blood pressure. His previous blood pressure reading 6 months ago was 136 over 85 millimeters of mercury, and his readings at home since then have been between 130 and 140 millimeters of mercury, systolic, and between 80 and 90 millimeters of mercury, diastolic. Past medical history is otherwise unremarkable, and he is not on any medications. He consumes hamburgers and fries with beer at least 4 days per week and does not exercise. He does not use illicit drugs, but smokes 5 cigarettes per day for the past 40 years. His blood pressure at this visit is 140 over 85 millimeters of mercury, and his body mass index, or BMI, is 26. His other vital signs are within normal limits, and his physical examination is unremarkable. A complete blood count, chemistry panel, and lipid panel are normal. An electrocardiogram is within normal limits. Which of the following would have the greatest impact on decreasing his blood pressure? A. Dietary approaches to stop hypertension diet, also called the DASH diet. B. Lose 10 kilograms of weight. C. Smoking cessation. D. Stop drinking alcohol. Or E. Walk 30 minutes for 5 days per week. The correct answer is A. The DASH diet. In patients with hypertension, lifestyle modifications play a crucial role in managing and reducing blood pressure. Among the interventions listed, the DASH diet has been shown to have the most significant impact on lowering systolic blood pressure. The DASH diet is a dietary pattern that emphasizes the consumption of fruits, vegetables, legumes, low-fat dairy products, and foods low in saturated and total fats. Clinical studies have demonstrated that adherence to the DASH diet can produce a reduction in systolic blood pressure by approximately 11 millimeters of mercury, which is the highest reduction compared to other lifestyle modifications. Answer choice B, lose 10 kilograms of weight, is incorrect. Reducing the BMI to less than 25 kilograms per square meter can decrease systolic blood pressure by about 6 millimeters of mercury per 10 kilograms of weight loss. However, the patient's BMI is 26, and losing 10 kilograms may not be as impactful compared to dietary changes for this patient. Answer choice C, smoking cessation, is incorrect. Smoking cessation is crucial for overall cardiovascular health, but does not have a significant and consistent effect on lowering blood pressure. Answer choice D, stop drinking alcohol, is incorrect. Limiting alcohol intake to 2 or less drinks per day for men and 1 or less drink per day for women can result in a 5 millimeter of mercury reduction in systolic blood pressure. However, the impact is generally smaller compared to the DASH diet. Answer choice E, walking 30 minutes for 5 days per week, is incorrect. Engaging in regular aerobic exercise, such as 30 minutes per day for 5 or more days per week, can reduce systolic blood pressure by about 7 millimeters of mercury. However, the impact is generally smaller compared to the DASH diet. The key learning point here: in hypertensive patients, the DASH diet, which is rich in fruits, vegetables, legumes, and low-fat dairy, can reduce systolic blood pressure by approximately 11 millimeters of mercury, making it the most effective lifestyle intervention. Okay, that's it for this episode, but please do check out our other episodes, and a reminder that you can find these questions and many more on our website at medprep2go.com.
Hey, Ryan Reynolds here, wishing you a very happy half-off holiday because right now Mint Mobile is offering you the gift of 50% off unlimited. To be clear, that's half price, not half the service. And Mint is still premium unlimited wireless for a great price. So that means a half day, yeah? Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.